gonna attack you for no matter what you do. So you better do the right thing, because otherwise it won't work. Because I agree that there ought to be a mandate. Everybody's got to be in the pool. Otherwise we can't keep the costs. You know, who doesn't have a healthcare tragedy story? Everybody does. But the logic is simple. If you're going to keep the cost down, you have to have a public option. Honestly, you have to have single payer, but okay. You have to have a public option. We'll get to single payer soon. But in the meantime, this is what we have to do. And I have to. So I'll just make a pitch put my own feelings out there right away. If we could get rid of all the gatekeeping and go with single payer, you know, 4 or 5 public hearings around the state. They've been working very hard and very fast. So they collected something like 500 different specific ideas for how to improve Medicaid. And I'll be the first one to say it ain't perfect, and it needs to be streamlined. It needs to be made more efficient. It needs to be more fair. It needs to be more consistent. It needs to be single payer. But okay, everybody would save New York State by 2019 $20 billion a year. The private insurance market would disappear. Our taxes would go up, but everything else would go away. And we keep trying to get the governor and the comptroller to look at this. In fact, we've asked the comptroller to just run the numbers, to just do a study and say, you know, would you take that study and see if you can replicate it and find out. You're a number cruncher. And when he was in the assembly, Tom DiNapoli was a strong single-payer supporter. We will be trying to make that pitch that now is the time to do this. We have to redesign things for the Affordable Care. Is Medicaid. Also, that would go away. This is not just about your federal taxes going up. There are 100 places where your costs would go down as soon as the federal government made it rational and made it a single payer preferably, but even the public option is going to bring cost savings and better health care to all of us. So thanks again, Rebecca, for having us today.